Hello, it's Friday, July 12th, and it must be time for another update from your North Carolina Medical Society. Wow.
We're here. We're still here.
Woo! All right, folks. We're going to hit a couple of highlights and then go over what is, I hope everybody in the state has been reading about in the newspapers this week.
I don't know how you could have missed it.
Yeah, but here we go. First thing is birth center regulation, something that we've been looking for because of some significant controversy, of course, unfortunate outcomes, has finally passed through the House and is over at the Senate. I don't think this one gets done before the end of this session, but hopefully sometime in the interim when we're coming back or in the short session, we've at least got it positioned and ready to go that birth centers will now be regulated by the Department of Health and Human Services, and proper oversight will be done for those facilities.
A great stakeholder input meeting.
Big one.
That had a lot of discussion for over a year
Yes.
during the interim, so had a lot of input on this bill. Nobody's really opposing the bill, but just having some time getting through the entire process.
That's right. A lot of technical aspects to this thing.
It's a big bill.
Right. Who manages it? Who oversees it? Why? For what regulations? What standards do you put out there? What consequences are in place if something doesn't go properly? So a lot there. But
A lot to that one.
OBs, hats off to you. The North Carolina OBGYN Society has just done a fantastic job of working on this, along with their nurse counterparts and other facility folks, all coming together and really making that happen.
Yeah.
Yeah.
That's a great one.
Good stuff.
Another bill that moved this week was House Bill 220, which is the Department of Insurance technical corrections that had a piece in it that we were
Concerned
about.
Yeah.
That we appreciate your action alert response on. We were able to get that pulled out. So,
Right.
But that bill's moving forward
Right.
as well.
So this does not include the narrow networks provision that we talked to you about last week. We are still in conversations with the Department of Insurance and others about that.
And the chairs.
And the chairs and the co-sponsors of the bills, both the House and the Senate version. But it's not in the piece that has moved or is getting ready to move next week.
Right.
Almost.
And everyone seemed to agree that piece needed some more conversation.
Yes.
So that was great.
Yes.
And thankful for your input on that action alert, because that was what we hope pulled the piece out.
Most definitely. So on to the big news of the week. So we've talked to you about the legislature passed a budget, the governor vetoed it, and of course we were setting up for the third budget by Governor Cooper veto override of a budget. But it didn't happen. So we waited around on Monday and it didn't happen. We waited around on Tuesday, it didn't happen.
Scheduled sessions kept getting pushed back
Yes.
and pushed back
Yes.
from noon to 2 to 3
Right.
to 4 each day, and still no vote.
That's right. Lots of conversation, lots of drama about people rushing back to be on the floor in case a vote happened.
Some discussion about the order of bills
Yeah.
in case the vote happened.
Yeah.
So if they were going to have to go through their calendar in regular order, if they could skip around.
Right.
A lot of conversation and controversy around what order the bills were going to be taken
Right.
up for that reason.
Right. But what really mattered to us most is the fact that this Health Care for Working Families bill, House Bill 655, which we've talked to you about many times, it became a part of the bargaining package
Right.
with the budget, and currently sits on the House calendar along with the budget, waiting to be taken up.
So a proposed committee substitute was introduced in the House Health Committee to state that this bill would become law only if the budget became law. So that was the piece that was added to it. You can view our blog for a complete summary of the bill. It's the bill we've been asking you to talk about, but we're excited that it finally did get heard in House Health
Most
and
definitely.
now is sitting on the House calendar.
Right. And we got a couple of emails from members asking, why are you excited about this? Why are you excited about Medicaid expansion? And for folks that are asking for Medicaid expansion, I would say this is not your bill. And for the folks that are opposed to Medicaid expansion, this isn't that bill either. This is what we believe is the compromise. It's the state figuring out how to take care of folks that are stuck in the income categories between Medicaid and assistance by the federal government to get on the exchange. So this is really people that are out there working and can't commit a fourth or a third of their take-home salary to pay for health insurance premiums. So what do? We enroll them through the Department of Health and Human Services, which is Medicaid, so people automatically think it's Medicaid Light. It's not. We broker them through the PHPs, which are the new Medicaid contract entities which makes people think about it being Medicaid again. It's not. But the difference is that we treat them like commercial insurance pay. They have to pay a premium,
2%
just like
of their
income, just like all the rest of us are having to pay premium to buy commercial insurance. They have co-pays and deductibles, all those things that are traditional. It's just being organized and managed by the state of North Carolina because two things. First of all, the commercial plans don't offer something that is affordable to these folks. And secondly, we can draw down federal funds to pay for this. So it's a great way to help a population in the state of North Carolina that is in desperate need of health care, access to health care, without it costing the state a single dollar, without us relying upon the commercial entities to take the responsibility for it, but getting your patients something so that they can make sure they can see you, they can get access to drugs, they can go to the hospital if they need to.
And preventative care is really the cornerstone of this bill as well.
That's right.
And another important piece to point out is the rural component of the bill that would allow some grant funding for rural loan repayment, for telemedicine, rural health infrastructure. So a number of pieces that could be used to help our rural communities and their access to health care.
That's right. So that's why we put the action alert out in the middle of the day, and we realized that was a perfectly terrible time because you were all taking care of patients. But it was important. We've got the last minute notice that it was going to go out. We wanted to see that it was actually going to make it through a committee before we sent you out asking for this thing to happen. And then the action alert was to go to every member of the House because as it is sitting right now on the House floor, we wanted you to encourage your House member to vote for this bill.
But we did personally thank every single legislator who voted yes in the House Health Committee. So that was positive. We wanted to thank them for their support of this bill and this important issue.
That's right. 25 of 31 members of the House Health Committee in attendance voted for this bill.
Bipartisan.
Absolutely incredible. Yeah. That's right, bipartisan. So we're encouraged that this conversation is occurring. We think this is the right step. We think it is a compromise. It's not partisan one way or another, and it's really focused on helping North Carolinians. So we're excited about that. Right along the same time as everything was getting bogged down with this bill, in attachment to the potential not really happening of the veto override, we had to figure out what happens if we don't end up having a budget.
So a stopgap bill was introduced with a number of components, including some funding for Medicaid transformation. So we were glad to see that that was in there. But a number of different provisions and the suicide hotline, because that funding within the budget is not recurring funding. So they had to have some measure in place for the suicide hotline to continue. That's
right. And so we needed a stopgap, not because we had to keep the budget going. The budget as of 2016 rolls forward no matter what. So there is no government shutdown, people don't stop getting paid, all that sort of thing. But as Sue Ann pointed out, this stopgap made sure that the federal fund drawdowns that don't happen unless we reauthorize them every year, along with some other things, continued. Right? That still hasn't fully moved forward either. Right. So we're really at this place where we're not really sure how this is all going to play out. We just know that we're taking the weekend break. We're all coming back on Monday, and we're going to keep this conversation going.
And the Senate has drawn up adjournment resolution.
They have.
To leave on July 22nd and come back August 27th, but unsure if that will move. So
that's right.
Stay tuned for if that moves forward as well.
So it's July in Raleigh. It's getting hot, and it's probably going to get hotter before this is all said and done. So we hope that it starts to cool down soon, or we cool down back at home.
By pool or ocean or
breeze anywhere would be fantastic right now. But we do hope that you reach out in the meantime to your House member and encourage them on House Bill 655 to take care of more North Carolina working families. Have a great weekend.